Hello again, and welcome back to the channel. Today we're going to talk about injury and recovery. As we all know, if we're football followers, that this year has been fraught with injuries, more than average, and many of your teams, many of your fantasy football teams have been very affected by the number of injuries this year. And maybe your team, which you thought was going to be stellar and make it this year, they had a great chance, had some injuries, and didn't make it. So let's talk a little bit more straightforward about injuries, prevention, and when injuries do happen, how do we recover from it as quickly as possible? So let's talk about the most common sports injuries. The one this year that's been the most prominent is an ACL tear. This is the knee. I have the knee bent here, and I have the patella tendon pulled to the side so we can see the middle structure of the knee. This tendon or ligament in the middle is called the ACL, anterior cruciate ligament. And that's the tendon that keeps the knee, when you stop and turn, it keeps it from sliding off forward. And so that's a big stabilizer of the knee. And in knee injuries where the knee is possibly bent and then there's a turn or there's a hit of the knee, that is the area that is injured frequently. The ACL tear can be partial, it can be complete, and when it's complete, it's very likely that it will come back together. That's why there's a surgical indication for a complete ACL tear. But a strain, a sprain, a partial tear can help to be healed by cellular therapies. Two of the cellular therapies that are mainly used are something called PRP, which stands for platelet-rich plasma. And platelet-rich plasma is a product we get from the blood, from your own blood, and we spin it down, we get the activated platelets and the plasma. Now, all PRP is not created equal. There is what I would call standard PRP, and then there's ultra concentrate PRP. Standard is we take 15 mLs of blood, we spin it down, we get about 5 mLs out that have some platelets in it. But an ultra concentrate PRP is taking 60 mLs or 120 mLs of blood and condensing that down into a concentrate of 5 or 6 mLs. And that is much more powerful. You can see concentrating 15 down into 5 versus concentrating 120 down into 5. You have a lot more platelets, a lot more activity that can be involved. And the platelets actually act a little bit like stem cells, kind of like mini stem cells. They're not quite as powerful. They can't do quite as much, but it has shown to be a significant therapy in helping heal minor injuries. That's often what we'll use in a standard ACL partial tear or a sprain, even a partial meniscus tear, which are the pads of the knees. Again, looking at the inside structure of the knee, the meniscus, I'm going to tilt it here, is this blue structure that you see. It's the cup that the knee rides in, which also keeps it stable. And that can get torn either with partial tears. They can be across, like around the circle. So around the circle part of the knee, kind of around, or it can be vertical, like straight from the outside to the inside. And it can be in the front, it can be in the back. The most common ones are in the back part of the knee, and those can cause a lot of pain and sometimes instability. Those two types of injuries can be helped. If they're not too severe, they can be helped by PRP. If they're more severe, stem cells, such as umbilical cord stem cells, there can also be adipose-derived or bone marrow-derived, but I, in my personal opinion, feel they're not as good because we can't really verify their concentration. We can't verify their potency, and they're from old us, not from fresh baby cells. And so umbilical cord are usually much more active, much more potent, and have a better healing capacity and a long-term effect. They are much more powerful. They are active live cells. They tend to go to areas of inflammation, and they act like a matrix that the body can build with. It's kind of like giving the body extra cells to fill in the gaps and to repair the area. Stem cell therapy is a very potent therapy, and it also is not, because it's considered a cellular therapy and an allograft, just like a graft from a tendon or ligament, it's considered very acceptable in sports type injuries because it's not an anabolic steroid or anything like that we're using that could create an advantage for one player over another. It's just got massive healing capacity. Those are the types of cellular therapies that can be done for these types of injuries. Also, other soft tissue injuries. We can get partial muscle tears. I've treated MMA fighters are very typical for getting either a partial glute tear or a hamstring tear, or something with a kick that they're doing because the force that they're having can tear their muscles. And if you can target that area very directly, either with ultrasound or x-ray guidance, you can get the stem cells right in that area where the tear is. And I've seen significant rapid improvements and recovery from those injuries, getting them back in the ring faster and getting them recovered. Another injury that is a major injury is ankles, especially in sports that are on the ground running. Usually it is the outside of the ankle that is injured in an ankle injury. So you roll the foot inward and it strains these ligaments here. And if there's a fracture, it could usually be of this bone here, the end part of the fibula, called the lateral, which means it's on the outside, lateral malleolus. In any sort of twist or roll, you can injure this ligament, which is actually harder to heal than if the bone fractures. Fractures heal more completely, so it absorbs the impact and doesn't stretch out the ligament. The most common fractures are of the ankle torquing and the main bone called the talus here, hitting up against this bone and fracturing the tip of it off or the end of it off. If it's a non-displaced fracture, that would mean that it's intact, it's in place, and it wouldn't need anything but a splint to hold it in place so it can heal. If it is actually out of place, then it may need a surgery of some kind to screw it back into place so that it can heal in proper alignment. Again, stem cell therapies can help to strengthen those ligaments and accelerate the healing process, giving more tools for the body to use to build and rebuild that ligament or tendon. Another major injury in baseball and basketball more, I've treated a lot of patients at a professional level that have those types of partial supraspinatus tears, labrum tears, and those are more throwing injuries. Or another type of injury if the arm is up and it is extended and then it meets a resistance of some kind, such as a block or something like that, that can tear a rotator cuff. Those rotator cuff and labrum are critical, and they do heal very well with assistance if it's not a complete tear. Again, complete tears tend to be more surgical, but partial tears that still have some intact fibers and are holding the ligament close together, then we can fill in the gaps with cellular therapies. So let's talk a little bit about prevention. As we age, our ligaments can't get stronger as fast as our muscles can. With high-level athletes, they've probably been working out all their life. They've strengthened their tendons. There's not a lot of prevention that can be done other than continue the workouts, the strengthening, and doing what they're regularly doing. But for us everyday people that may have times where we lapse in our exercise and then we're getting back into it, one main thing is to start out easy on yourself and work your way up. You don't have to work out heavy. You don't have to look like you're lifting all that weight in the gym. Get those big plastic weights that say 10 pounds but look like 45s. Do something like that. You can work those muscles different ways. You can work slow and intentional. You can be slow and intentional through the motions. That's a way to work the muscle just as much but not go as heavy, because As we get older, we snap tendons much more easily, especially when we're trying to get back into exercise, back into working out. There's another thing that is out is called blood restriction, something called Kaatsu bands, where you can restrict the blood flow to the muscles and you can lift lighter and build more muscle with less weight and actually less work. Basically, you're depriving the muscle of oxygen while it's working, and that stimulates more growth. And that will also stimulate more growth of the tendon as well, and you're not stressing it as much. Another area of prevention that really helps when you're working out is your warm-up. So warm-up is warming up the muscles and the ligaments and tendons. And part of that includes stretching, getting things a little more flexible. So stretching regularly, not too intensely, but regularly, can really help in preserving your tendons, because many people don't realize that stretching is just as important to the muscles and the ligaments and tendons as the exercise is. Always pay attention to your nutrition, because you need higher protein and collagen like supplementation when you are starting to lift again, because you're building. You need to provide building blocks for your body to use. So you need protein, and you need to digest that protein well. And so, there are lots of good protein supplementation out there, but real whole foods are always the best. You also need some carbohydrates for the energy. And so the best time to get carbohydrates into your body again is because you have glycogen in your muscles, and you use that up when you exercise, and that's replenished usually in the first hour after exercise. It's always good to get some fruit or something immediately after exercise to replenish your glycogen stores so that you have glycogen available for the next workout. Another important thing that we often leave out is the importance of water. Water is what our body is mostly made of, and most of us are running on a dehydrated state. Most of us are running behind because a lot of the drinks that we introduce from early in the morning on in our day are either caffeinated or have some sort of sweetener or sugar in them. And all those things act as diuretics and clear out just as much water as we intake. And so drinking only water and good water, and if you're having trouble retaining water, even a little pinch of salt in the water can be very helpful. And you'll be surprised at how much it makes it easier to drink that water sometimes. I love to see someone with one of those big old cups and they're drinking it all day long, because I know they're actually getting real water intake. And sometimes you can throw one of the hydration packs in those to add to the retention of that water. Most of us are afraid of swelling and other things and salt intake. But unless we have some sort of disease state, salt and water are both very good for us. So water and salt intake is very important when we're trying to exercise and trying to be as fit as possible. And it lubricates the joints. If you drink more water and you have any joint pain, you can possibly get rid of it with water alone. For those of us not in the professional athlete forum, there are many other things that help your body recover from injury faster. There are peptides such as BPC 157 and TB 500, which help to recover muscles faster and cause increase in blood vessel proliferation, which are both things that help tendons, ligaments recover better. There are selective androgen receptor modulators, which you have to be careful with when you're trying to build muscle, because they help you build muscle faster. And like I said before, as you build muscle faster, your tendons may not be able to keep up with your muscle growth. But those are things that we can use in injuries. Also, testosterone therapy for men and women to get their levels at an optimal level will help to build muscle more steadily and more quickly. And so I'm talking about physiologic levels. I'm talking about deficiencies and getting you back to normal, not what we'd call juicing of those levels. And then when we want to, when we're talking about selective androgen receptor modulators, the most popular two are LGD 4033. Ligandrol is the other name. And that one's been most established with the least amount of side effects. It was originally developed for prevention of muscle wasting in patients in the ICU, and very low doses, 0.5 milligrams a day, kept muscle wasting away. Almost no muscle loss for a patient in the ICU for a week, which is incredible. The bodybuilding industry picked that up as a positive sign because these agents are so much more anabolic, which means building bone, muscle, tendon, ligaments, and much less androgenic, which means growing facial hair and lowering your voice and those side effects that other people don't want. A lot of times we don't think of using every advantage that we have for people that are injured or have injuries and are trying to recover, because we need to grow and build those muscles back more quickly to support all the structures that have been injured or damaged. And so we want to accelerate that recovery. Another one that is better for women is ostarine, because it has even a lower androgenic to anabolic ratio, like 5 to 200. 5 androgenic and 200 anabolic. So very little effect on the androgenic side. And so that can be an advantage for building muscle or recovering in women with injuries as well. Again, some of these agents are banned in the professional realm, but are available to you to use if you have an injury and you want to recover faster, because we're not in any competition scenario. But we are in competition with the speed of recovery, because dysfunction in the body, when it's left for a long time, our body starts to mold and adapt to that dysfunction. And the faster we can recover, the less of that dysfunction we have to readapt back to being normal. So we want to restore normalcy as quickly as possible. That's very important. And that's the concept I use with my patients is let's restore normalcy as quickly as possible so that your body doesn't get into a dysfunctional state that becomes chronic. So thanks for joining us today, talking about injury, prevention, recovery. We hope that it's been informational. We hope that you will like us, subscribe, ring the bell. With that, stay safe, be well, and love your family.